a lesion on my nether region? No, I think it's just tracks from my Brazilian wax. But that's got me thinking, what's the deal with genital herpes? With all the things going on in the world, I like to talk about vaginas, even uncomfortable topics like genital herpes. I'm Madge the Vag, and there's no shame in my vagina game.
Herpes. Are you ready for herpes? True or false? Cold sores are a form of herpes.
They are. That is true.
True? Yes, they are. They're a form of herpes simplex.
I would say true.
How many herpes simplexes are there? Do you know?
I know there's at least 2, right?
That I don't know. I just know there's multiple.
There's only 2. Hello. What are yours? Do you know where the simplexes are?
Ooh.
I think one is up on your mouth and one is vaginal or a groin area.
Yep, Diane, you are. You know your stuff. I'm very impressed with you.
I'm an old woman. I've had this thing for a while.
Well, thank you for coming, Dr. Fraser.
No problem. Happy to be here.
And we are talking about genital herpes. Actually, all the herpes.
Yeah.
There's more than one type of herpes.
There's a lot of herpes.
There's a simplex 1 and there's a simplex 2, but that's not simple at all.
It can be tricky.
What is the difference between a 1 and a 2?
So herpes simplex 1 is actually very common because sometimes even kids can get it because any type of, skin-to-skin contact. So kissing can transmit it. It's very simple. It doesn't have to be sexual contact. So think of a cold sore. It usually starts as a little bump that can have a little bit of fluid in it, and then it sort of opens up, and that's when we call it an ulcer. So on the mouth or orally, you usually have like maybe 1 ulcer. Genitally, you can have multiple. So you might have like a cluster of little bumps, and then it opens and it becomes ulcers, and then you can have a cluster of ulcers, and that can be very painful.
So what I'm understanding is simplex 1 is milder. You might get a sore here, and then it will go away. It's not comfortable, but it's not the end of the world. Simplex 2, on the other hand, is a cluster or a lot of them, and that's going to be far more uncomfortable and painful. Can simplex 1 get down here, and can simplex 2 get up here?
So yes. So typically in the US, simplex 1 we thought it was just oral, and simplex 2 was just genitally. Actually in Europe, it was the opposite. So they would have more simplex 1 genitally and more simplex 2 orally. In recent times, when I test patients, they have their initial outbreak, most of them are actually turning out to be simplex 1 in the genital area.
Well, first, how is it transmitted? How is herpes transmitted?
So herpes is transmitted skin to skin. So any skin to skin contact, but it's a certain type of skin. So you don't usually get herpes on like your hands or
not
your legs.
handshaking.
So it's a type of what we call like mucosa. So sort of like a thinner type of tissue. So think of the genital area, think of the mouth.
Is it only spread when you have the symptoms of the sores?
Unfortunately, no.
Oh.
Because some people, the longer you've had an infection, you may not notice it. So as time goes on, your symptoms of a herpes infection aren't as strong. So some people may be they may be what we call shedding the virus. So it's sort of like active, your skin is shedding the virus, but you may not have, your immune system kind of learns how to deal with it. So you don't have like all these great sores and things like that, but you can still spread it, or it might be healing, or you just really didn't notice that something was going on, and then you can spread it that way.
So can you get rid of it on your own eventually?
So the virus itself never goes away. It stays in your cells forever. Some people, though, they can have the infection, they can have 1 outbreak, and they may never have another outbreak in their lives. But they have the potential to, but they don't. Some people, they have multiple outbreaks every few months. It depends.
Do certain things bring out the sores, like stress or?
During stressful times, people tend to get more outbreaks, either cold sores, which is probably why, when people have a cold, they get a sore, and it's like, oh, those are cold sores.
Ooh, God bless you.
You're more prone to it during those times when your immune system isn't as strong.
And just to be clear, where can the outbreaks occur?
Yeah, so you can have it on the inside of your mouth. Most typically we see it most commonly on the outside. You can have it genitally, so you can have it on the outside, so the vulva, the labia. You can have it inside the vagina. You can have it on the cervix. Someone would have to actually, we do that if a patient comes in labor and they have a history of herpes. We want to look at the cervix. We want to look inside to make sure there's nothing that we're missing. You can get it anally.
You can get more than one herpes?
You can.
You could get the Simplex 1 and the Simplex 2.
That's
and you
correct.
get Simplex 1 in both spots.
Correct.
And 2 on both spots.
Correct.
You could be full of herpes. Oh, that would be unfortunate.
You can.
What if you're pregnant and you have herpes? You've had herpes,
Right.
now you're pregnant. What happens with the baby?
So thankfully, if you already know that you have a history of herpes, that's good. So you should let your doctor know so that they can plan for it. Throughout pregnancy, if you have an outbreak, you can take antiviral medication for it. That's completely safe. And typically, if the plan is for you to have a vaginal delivery, we will start that antiviral medication at around 36 weeks pregnant. So we want to prevent you from having an outbreak when you do give birth. So we'll start it, for our best estimation, 36 weeks, and you take it every day to sort of prevent an outbreak.
And then if the baby comes through without anything happening, you should be okay.
Correct.
Because now you know you're preventing any outbreaks.
Right.
You're
But-
not unsure, so it should be okay.
Correct. But we still always do a complete exam on anyone that has a history of herpes. We'll look inside the vagina and at the cervix just to make sure there's nothing that we're missing to the best of our ability.
And you cannot cure it. So how do you manage it? You have herpes, what do you do?
So basically you just want to be aware of when you have symptoms. I always tell patients, if you're not sure, they're like, oh, this is a little bit different, I'm not sure, go in, see the doctor, get it tested so that you can say, oh yes, this is how this is presenting right now. So basically you just be aware, and then depending on how bad your symptoms are, you can get medication for it. It doesn't
Antiviral.
Correct. So it doesn't take it completely away right away, but it'll shorten the duration of
Okay.
the
So it
outbreak.
makes it better.
Makes it better.
Can you eat certain foods? Does your diet make a difference? Exercise? You said stress doesn't make it better.
Right.
Maybe that can help. Is that?
So definitely being healthy, living a healthy lifestyle, keeping your immune system in tip-top shape is good. Lysine is an amino acid. You can get it in a pill, and that's, some people take it, and it does sometimes help prevent recurrent outbreaks. So that's something over the counter that you can try as well.
Okay. Now, if I have herpes, I have a partner in my life, how do I avoid giving it to my partner?
You want to be honest and open and let your partner know so that you want to take precautions and they understand why you're taking such precautions. So one way is to use condoms with every sexual encounter. That includes condoms like male condoms, also female condoms, so in the vagina, dental dams, because again, we're saying
Watch
that
the oral.
mouth to genital area can also spread it. Because it's skin to skin, it can never be 100%, like condoms won't be 100%
Right.
preventative for herpes, so you just want to be aware if you have any symptoms, anything that could possibly be a tingling, and then you want to avoid sex during those times. You can also take the medication, the antiviral medication, every day to try to basically prevent having outbreaks and shedding the virus and decrease your risk of transmitting it. Typically, we recommend that if you're a person that has frequent outbreaks, so more than 4 outbreaks a year, then you're probably a good candidate for antiviral medications. Anyone can opt to, but that's the ideal person in terms of like risk benefit.
But you want to let your body seems like your body learns to fight it off a bit
Correct.
on its own.
Correct.
So get tested. If you have symptoms,
For herpes, yep.
talk to your doctors, talk to your partners.
Correct.
And don't worry, there's ways to manage it.
Correct.
But always talk to everybody. Gotta talk about it.
Be open like everything else.
Be open like a sore.
Genital herpes is preventable, and if you have it, it's treatable and manageable. I don't know about you, but I feel better already. I'm Madge the Vag, and don't forget to subscribe, comment, and share our YouTube channel, Scary Mommy TV.